I'm Paul Tsaku. I work with TLM Nigeria as the research advisor. I have a PhD in medical microbiology. I joined TLM in July 2020. The first one is titled Strengthening Integrated NTD in Zamfara State. In this, we are looking for documented evidence of effective approaches to integrated leprosy, lymphatic filariasis, and mental health program for informed policy. We want to look at mental health, such as depression, anxiety, and how it relates to this disease condition. We want to also look at how the health services has been able to provide the needed support for these people. The other mental health project is titled Neglected Mind-Skin Link. Here we are looking at the mental health well-being of people with skin NTDs in Benue State, and it will help in formative piloting of WHO guide on mental health and NTDs. First of all, we go to the healthcare facilities. We want to look at what they have in place and whether they have the capacity to measure mental health on their own, even before we come for this study. So we will look at their own documents, and then we have some tools that will help us to measure the mental. We are going to use some questionnaire. A mood scale will be applied to the respondent so that certain measurement will be taken after the questionnaire has been administered to uh, consider or to look at their mental health status. The research is very important in the sense that we are dealing with people with conditions that are considered neglected. These people are actually the poorest of the poor. They have been neglected over time, and some of them in this condition, they face stigma. They are being rejected. They are being kept in isolation. And because of that, they face a lot of challenges. They have a lot of needs, financial and several other needs. There are one or two persons I have come across, uh, and then I realized that they have serious challenges with their mental health due to poor economic condition, due to several challenges. They have family to raise, and there is almost no source of income, and there are troubles here and there. They feel neglected, they feel abandoned, they feel dejected. So this kind of situation leads to severe mental health condition. I have met people who shared certain experiences, which yeah, it's quite disheartening. Basically, this research is more of qualitative research, even though there will be some quantitative methods here and there where the need may arise. But what we want to get from this research, most importantly, is to give the people involved the opportunity to air their view, to speak their mind, to say how they understand these things, what they feel about it, and what they think should be done. So this will give us, that is why we cannot be able to conclude the kind of outcome we will get from this research, but it gives us an opportunity to even encounter some unexpected result, which will be very good, which will be very good for policy, for decision to be taken. We're going to have a kind of clue and how many people affected by leprosy and lymphatic filariasis also have mental health challenge. We're also going to find out if there are government policies that are put in place for integration of mental health and NTDs. We also hope to see if there is any kind of support available, a structural or otherwise, for people with mental health and leprosy and lymphatic filariasis. In Benue State as well, we hope that the outcome of our research will help in the formative stage or piloting of WHO guide for mental health and NTDs. So there are a lot of things we hope to find out with this research. The entire goal of the leprosy mission is to see leprosy defeated and life transformed. So basically our research is also in that line, and we hope that uh, through our research, we will be able to support people who are already affected by leprosy, and it will also help in policy makers, the government, and globally to make decisions that will help people with NTDs.